Talk about congenital neuroproliferative vestibulodynia, and that's a mouthful, so let's break it down. Vestibulodynia, vestibule means entrance, dynia means pain. It's pain at the vaginal vestibule or the vaginal entrance. Congenital neuroproliferative, congenital means from birth, and neuroproliferative means a proliferation of nerves. So what this condition is it's pain at the vaginal entrance that's caused by a congenital increase in nerve endings and mast cells. So what these people experience is usually like a burning, stinging, or tearing type of pain right around the vaginal entrance, often with touch or with attempted insertion. Trademark symptoms are that it has been there since the very first time they've ever started to try to insert anything. So like with a tampon or with a finger or anything like that, it has always been painful to try to either touch that area or insert things. With an examination, there is going to be tenderness and pain when we touch kind of anywhere around that vaginal entrance. And an interesting fact is that around 60% of women who have this also have a hypersensitive belly button. To really truly get this diagnosed, they do have to look at the actual tissue of the vaginal entrance or the vestibule, which not all OBGYNs are necessarily set up to do, but they have to be able to actually see kind of the increased number of nerve endings in that area. And the golden standard for this right now is a vestibulectomy, because this type of vestibulodynia is not necessarily going to get a lot better with pelvic physical therapy because it's not related to pelvic floor tightness. We actually have more nerves than we need in that area. So with surgery, they go in and they actually remove that part of the vaginal vestibule. They kind of remove some of those nerve endings, and that tends to be the gold standard for people who have this condition. There are some studies now sort of coming out on different medications that can potentially be used for this, but we're still kind of in the early stages of that. This is often a very frustrating condition because people try to look for a long time for answers about why they have this pain. They often try multiple types of treatment. They try pelvic physical therapy, they try Botox, they try medications, and nothing is necessarily working, but it can be an incredibly frustrating condition to have.